Then here's the Systemic Infections intro for Chapter 21. Systemic Infections Chapter Objectives. Nucleosis called Too Tired for Soccer. Myra, a 16-year-old soccer player, complained of a sore throat and woke up in a cold sweat for 2 days in a row. She felt pretty tired but still wanted to go to soccer practice. Her mom was reluctant to give her permission to practice unless Myra went to see the pediatrician first. On the right is a photo of someone with mono, and their enlarged tonsils are shown. Well, when she got to the clinic, and the nurse practitioner examined her, and they found that Myra had a mild fever, pharyngitis, swollen tonsils, and swollen lymph nodes in her neck. They swabbed Myra's throat to check for infectious mononucleosis, also known as mono, and strep throat. The mono test came back positive, and then suddenly, Myra remembered her boyfriend complaining of a sore throat a few weeks back. The nurse practitioner to rest, take ibuprofen for pain, and to call the office if symptoms got any worse. Myra was advised to not take any aspirin because it could cause a severe reaction. The nurse practitioner also stressed that Myra should not play any soccer or engage in any other strenuous physical activity for 4 weeks because her spleen could be enlarged as a result of the infection. This enlarged spleen could then rupture if she were to fall or hit the left side of her body. A ruptured spleen would cause internal bleeding, which is life-threatening. The clinic to see whether or not she could start playing soccer again. She returned for a follow-up visit as requested by the clinic. The nurse practitioner examined Myra and told her that she could return to playing soccer because her spleen was no longer enlarged. Myra was happy to finally be able to go back to her soccer practice that afternoon and resume her normal life. Mononucleosis is also known as mono, which is the disease that Myra had. It's a good example of a systemic infection. A systemic infection is an infection that starts in one part of the body and eventually infects and spreads to another. Systemic microbes use the blood or lymph as a path of travel usually. The virus that causes mononucleosis is called Epstein-Barr virus, and it originally infected the epithelium of Myra's oropharynx, which caused her sore throat. The virus was systemic because it caused different issues like enlarged lymph nodes, mild fever, fatigue, and night sweats. Many systemic infections are bacterial diseases and can cause systemic infections that may affect the organ system.
I'm Lauren Moore, and I will be covering the anatomy of the cardiovascular and lymphatic system. The cardiovascular and lymphatic system are integral components of the circulatory system, each playing crucial roles in maintaining homeostasis, transporting fluids, and supporting immune function. The heart is a muscular organ responsible for pumping blood throughout the body and consists of 4 chambers: the right atrium, right ventricle, left atrium, and left ventricle. The atriums are the receiving chambers of the heart, while the ventricles are the pumping chambers. The heart contains various types of blood vessels, including arteries, veins, and capillaries. Arteries carry oxygenated blood away from the heart, except for pulmonary arteries, which carry deoxygenated blood to the lungs. Veins carry deoxygenated blood back to the heart, except for pulmonary veins, which carry oxygenated blood from the lungs. The capillaries are microscopic vessels where the exchange of gases, nutrients, and waste occur between blood and tissues. Blood in the heart is composed of red blood cells, white blood cells, platelets, and plasma. It transports oxygen, nutrients, hormones, and waste products. Now we'll be moving on to the major structures of the lymphatic system, which include lymph, lymphatic vessels, lymph nodes, the spleen, thymus, and tonsils. Lymph is a clear fluid containing white blood cells, especially lymphocytes, and is similar to plasma. It plays a vital role in immune defense. The lymphatic vessels are blind-ended capillaries that collect lymph from tissue spaces and transport it to larger lymphatic vessels. The lymph nodes are small, bean-shaped structures that filter lymph and house immune cells, like lymphocytes and macrophages, that respond to pathogens. The spleen filters blood, removes older damaged blood cells, and produces lymphocytes. The thymus is where T lymphocytes mature and become functional immune cells. The last structure I'll be talking about are the tonsils, which are lymphoid tissues that help protect against pathogens entering through the mouth and nose. To sum up, the cardiovascular and lymphatic system are interconnected, working synergistically to ensure the proper circulation of blood and lymph, the maintenance of fluid balance, and the support of the body's immune responses. Now I'll be talking about systemic and pulmonary circulation. Systemic and pulmonary circulation are two distinct pathways of blood flow within the cardiovascular system, each serving specific functions. Systemic circulation is where blood is pumped from the left ventricle of the heart into the aorta. It travels through a network of arteries, arterioles, and capillaries to reach all body tissues. Oxygen-rich blood is delivered to organs and tissues, and after exchanging gases and nutrients, blood returns to the atrium of the heart from venules and veins. Pulmonary circulation is where blood is pumped from the right ventricle of the heart into the pulmonary arteries. These arteries branch in the smaller arterioles and finally reach the capillary beds in the lungs, where gas exchange occurs. After being oxygenated, blood returns to the left atrium through pulmonary veins. Both these systems could possibly become infected, which could cause a systemic infection, which is a type of infection that occurs when pathogens such as bacteria, viruses, fungi, or parasites invade the bloodstream and spread throughout the body, affecting multiple organs or systems rather than being localized to a specific area. Both systems are intimately linked to systemic infections in several ways. They serve as a pathway for pathogen dissemination, facilitate the transport of immune responses, help maintain organ function through oxygen and nutrient delivery, and play a role in toxin elimination. Understanding this relationship is crucial for managing systemic infections effectively and preventing serious complications such as sepsis and organ failure. Early recognition of signs of systemic infection and prompt medical intervention are essential to mitigate the harmful effects on both systems and overall health. The last topic I will be talking about is inflammation conditions within the heart and lymphatic structures. Endocarditis is an infection of the inner lining of the heart known as the endocardium. Pericarditis is an inflammation of the pericardium, which is the thin, double-layered sac-like membrane surrounding the heart. This condition can lead to various symptoms, most notably chest pain, which may worsen with deep breathing or lying down. Myocarditis is inflammation of the myocardium, which is the muscular layer of the heart wall responsible for contracting and pumping blood. This condition can reduce the heart's ability to pump blood effectively and can cause arrhythmias, which are irregular heartbeats. Now I'll be talking about these three conditions affecting the lymphatic system. Lymphadenopathy is the enlargement or swelling of lymph nodes. Lymphadenitis is the inflammation of one or more lymph nodes, often due to infection. Lymphangitis is defined as the inflammation of the lymphatic vessels. It typically occurs as a result of infection, most often caused by bacteria, but it can also be related to other conditions.
Hi, my name is Amelia Waldrop, and I will be presenting on systemic viral infections. A general overview of systemic infections. It is uncommon to see many systemic infections in North America. The most common types of systemic infections are the herpes family of viruses. The Epstein-Barr virus, the cause of infectious mononucleosis, herpes simplex virus, the cause of cold sores and genital herpes, and cytomegalovirus, the cause of an infection in individuals mono. These kinds of infections remain latent after the infection has passed. Alike with most infections, they are especially damaging to immunocompromised people. However, these infections are damaging to even healthy individuals, but they usually cause mild cases. Systemic dissemination of HSV can occur in immunocompromised individuals, causing viral meningitis. Climate change, among other factors, have also been impacting the reemergence of these infections through new routes of international travel, temperature changes, and many more causes. Infectious mononucleosis, the kissing disease. Epstein-Barr virus, known as infectious mononucleosis, has been tagged the kissing disease for its transit path through saliva. Epstein-Barr virus is a member of the herpes family of viruses, also known as human herpes virus 4. Many adults, more than 95%, are infected with EBV. Children living in new or underdeveloped countries are exposed to EBV by the age of 4. EBV is commonly diagnosed by using the symptoms fevers, pharyngitis, lymphadenopathy, fatigue, and splenomegaly. About 5% of patients develop a rash. Complications often seen with EBV are bacterial throat infections, spleen rupture, anemia, nervous system issues, jaundice, liver enlargement, and sometimes even death. Diagnosis for EBV is done by assessing the symptoms and testing for antibodies to the antigens of EBV. The treatment available for EBV is activity restriction and treatment of symptoms. There is no vaccine available. Infections of EBV are typically mild and resolve within 2 to 4 weeks of infection. However, the disease can stay for months in some cases. The top left figure displays a normal lymphocyte in a blood smear. Figure 2 shows the larger lymphocyte that can become present during a blood smear, which is often an indicator of Epstein-Barr virus. The figure on the top right displays symptoms often present with the Epstein-Barr virus in large tonsils. Cancers associated with Epstein-Barr virus. Burkitt's lymphoma is a cancer associated with the Epstein-Barr virus. Burkitt's lymphoma originates in the lymph nodes. Lymphoma is a cancer of the lymphocytes, while Burkitt's lymphoma is more specifically a cancer of B lymphocytes. The tumors observed from Burkitt's lymphoma are typically in the upper and lower jaw and around the eye. Burkitt's lymphoma was discovered by Dennis Parsons Burkitt and was a large endemic pediatric cancer primarily observed in Africa. While this connection became more public, Michael Anthony Epstein and Yvonne Barr were in attendance at one of Burkitt's lectures, and they reported finding a new strain of the virus in cultured lymphoblasts. The connection was discovered by chance when a handler of a Burkitt's lymphoma cell line came down with mono. The endemic variety of Burkitt's lymphoma is the most common type of childhood cancer seen in Africa. It has also been concluded that malaria increases the risk of endemic Burkitt's lymphoma. Burkitt's lymphoma is a rapidly progressing form of cancer, and it requires chemotherapy treatment. Figures A and B display a tumor in a young boy presenting with Burkitt's lymphoma. Pictured in the top right is Dennis Parsons Burkitt, the first person to characterize this type of lymphoma, which is why it bears his name. Cytomegalovirus infections. Cytomegalovirus is a double-stranded DNA virus, sometimes also called human herpes virus 5. CMV works by replicating in the epithelial cells, primarily in salivary glands. The virus fully infects by making its way to the lymphocytes, monocytes, kidneys, and other glands. CMV is a latent virus, meaning it remains undetected in host cell nuclei. However, CMV is a relatively asymptomatic or mild infection until it is passed down through vertical transmission, affecting fetuses as well as immunocompromised individuals. CMV is a relatively common worldwide disease. CMV infection primarily happens in childhood, and most individuals are asymptomatic and get rid of the virus over time by bodily fluids. The mode of transmission for CMV is contact with contaminated saliva. This transmission typically happens in daycare centers, between family members, sexual contact, or transplanted tissue. While the primary infection is typically asymptomatic, it can cause CMV mononucleosis, a mono-like disease, or hereditary negative mononucleosis. The main defense against CMV infection is cell-mediated immunity. This prevents secondary infections when the latent CMV virus is reactivated. Anything that suppresses the immune system is a major risk factor for reactivation of the CMV virus. Reinfection is when a person who has latent CMV virus is infected with a new strain of the virus. CMV can infect nearly every organ in the body, causing fevers, pneumonia, and many other symptoms. When CMV is passed down to newborns from their mothers, it is called congenital cytomegalovirus infection, or cytomegalic inclusion disease. Infection can begin as an infant and cause issues like low birth weight, small head, seizures, rashes, enlarged liver and spleen, and jaundice. Severe cases of this disease can be fatal, but most people do survive. The most common issue reported with CID is hearing loss. However, the disease remains one of the leading causes of mental disabilities in the USA. CID was discovered when it was found that infants with the disease had cells that looked much larger than other normal cells, and they had the appearance of owl's eyes. There is no vaccine available against cytomegalovirus. Figure 1 shows a tissue sample from a lung infected with CMV. It is showing the infected cell and 2 large inclusion bodies that have the appearance of owl's eyes. Other systemic viral diseases. While most commonly found outside of the U.S., other systemic viral diseases include dengue, hemorrhagic fever, Ebola virus, and chikungunya virus. Dengue fever is endemic to the tropics of Africa. Dengue fever is also known as breakbone fever. It has received its name based on its effects on victims, causing severe contortions due to intense joint pain and muscle pain. Dengue also causes symptoms like vomiting, rashes, organ failure, and shock. Dengue viruses are called arboviruses because they are transmitted by an arthropod, an insect vector, mosquitoes. It has been concluded that close to 400 million people are infected with dengue fever, and of that number, 22,000 die from severe dengue. There is a vaccine available, but it is only used in certain conditions. Treatment for dengue includes hospitalization and care to maintain hydration, pain, and need for transfusions. Dengue is diagnosed using virus isolation, PCR tests, serology tests, or positive tourniquet tests. Reemergence of systemic viral infections is especially concerning in less developed populations and countries. Ebola virus, a thread-like RNA virus, has been especially concerning to public health. Ebola is endemic to Africa and causes hemorrhagic fever. The outbreaks of the disease cause rapidly progressing fevers, muscle pains, and bleeding from the nose, mouth, anus, and vagina. Ebola virus has a 50 to 60% mortality rate. Death is prolonged and recovery is rare, and prolonged for those who can survive. The virus is transmitted via person-to-person contact with bodily fluids. There is an effective Ebola vaccine available for individuals 18 or older. Treatment consists of supportive treatment for pain management, hydration, and etc. Ebola hemorrhagic fever is diagnosed using clinical presentation, ELISA tests, antigen detection, serology, and isolation of virus in culture. Chikungunya fever, also known as chick fever or knuckle fever, presents with high fever, severe joint pain, rashes, and vomiting. The pain caused by chikungunya can persist for months and years after infection and can cause some heart, brain, and GI problems. Chikungunya is contracted by mosquito, more specifically the Asian tiger mosquito. Diagnosis is done by performing virus isolation or serology tests. Treatment is pain management and treatment of symptoms. There is no current vaccination for chikungunya, but there are experimental vaccines in clinical trials. The figure in the top right displays symptoms caused by dengue hemorrhagic fever. Other systemic viral diseases, less common in the USA, include yellow fever, Lassa fever, Crimean Congo hemorrhagic fever, Rift Valley fever, and Marburg hemorrhagic fever. Yellow fever is characterized by its high fever, chills, joint and muscle pains, and vomiting. The disease progresses to a toxic form, vomiting blood, jaundice, multi-organ failure, and even death. Yellow fever is caused by the Aedes aegypti mosquito. Yellow fever is diagnosed by using virus isolation and serology. Treatment involves hospitalization to control the bleeding and prevent more serious complications. Yellow fever has a live attenuated vaccine for travelers, residents, and laboratory staff. Lassa fever is a fever causing pain, vomiting, bleeding, and neurological symptoms and more. Hearing loss can occur and becomes permanent in 1/3 of cases. Lassa fever is caused by contact with rodent urine or droppings or with blood or bodily fluids of an infected person. Diagnosis is done by virus isolation, detection, or anti-Lassa virus antibodies, Lassa antigen, or QRT-PCR tests. Treatment is hospitalization, supportive care for the symptoms, and antiviral therapy with ribavirin. There is no vaccine available for Lassa virus. The Crimean Congo hemorrhagic fever is caused by contact with ixoid ticks, contact with blood or bodily fluids, or excretions of infected animals and humans. Symptoms present as high fever, back and joint pain, stomach pain, vomiting, sore throat, sore eyes, bleeding, and jaundice in severe cases. Joint pain can last post-infection for months to years. The causative agent is norovirus, also known as Asian Ebola virus and Congo virus. Diagnosis is done using ELISA testing, QRT-PCR, or isolation of virus in culture. Treatment is supportive treatment to manage symptoms. Some drugs are available but not approved by the FDA. There is no worldwide virus vaccine available for CCHF. Rift Valley fever presents as two different forms, mild and severe. In mild cases, flu-like symptoms are seen. In severe cases, heart failure, jaundice, purpura, and hemorrhage. Inflammation of the retina can lead to visual loss in 1 to 10% of cases. Rift Valley fever is transmitted by direct or indirect contact with blood or organs of infected animals, mosquitoes, or consuming unpasteurized animal products from infected animals. Virus diagnosis is done using virus isolation, ELISA for the presence of IgM antibodies specific to virus, and QRT-PCR. Treatment options available for supportive treatment, and there is no vaccine available. Marburg hemorrhagic fever presents with an acute high fever, severe headache, severe malaise, severe hemorrhage from several sites, and shock. Marburg fever has prolonged recovery and can result in inflammation of the testes, spinal cord, eye, or parotid gland, in some cases even death. Diagnosis is done using antigen detection by ELISA, QRT-PCR, serology in recovered patients, and skin biopsy for postmortem diagnosis. The only treatment available is supportive treatment, as there is no vaccine available. Figure 1 displays the mosquito that causes yellow fever. Viral infections of the heart include pericarditis, myocarditis, and endocarditis. These infections are caused when layers of the heart are infected by microbes circulating within. Viral infection of the pericardium causes inflammation and fluid buildup in the pericardial cavity, increasing intrapericardial pressure. This pressure causes chest pain and low fever. Infections of the myocardium can lead to cause the heart to lose its ability to contract the right way. Treatment for viral heart infections often requires draining of the pericardial sac for pericarditis. Antiviral therapy has not been shown to be effective. Most patients do recover from viral infections of the heart. Cardiomyopathies are often caused by echovirus, Epstein-Barr virus, and HIV. The top right figure displays an echocardiogram showing a normal-sized heart chamber. The bottom right figure displays an echocardiogram showing a small left ventricle with thickened walls, shown by the red arrows. This inflammatory process caused by a viral infection can result in left ventricular wall thickening. Thickening of the myocardium reduces the size, which means the heart cannot pump enough blood into circulation. The loss of blood supply damages the heart muscle.
Nancy, and I'm going to be doing the systemic infections involving multiple organs from chapter 21. History of Yersinia pestis, called prairie dogs, are not good companions. Some background on Yersinia pestis is that it's caused by rodents or wildlife, and it's able to be transmitted to humans through direct contact with the animal or with contact with fleas that have also been on an infected animal, which is through a vector route. The plague is a well-known zoonotic disease, which means it can be spread from animals to humans. A 25-year-old New Mexico rancher was admitted to an El Paso hospital due to a 2-day history of chills, fever of 104 degrees Fahrenheit, which is 40 degrees Celsius, and headache. Also, on the day of admission, he began vomiting. On the day of his admission, painful swelling in his groin area the size of an orange was noted. Lymph node aspirate and a smear of peripheral blood were reported to contain gram-negative rods that exhibited bipolar staining. Bipolar staining is when the ends of bacilli are stained more densely than the middle. The patient was also exhibiting a higher than normal white blood cell count of 24,700 microliters, and a normal white blood cell count is between 4,300 and 10,800 microliters. He was also exhibiting a lower than normal platelet count of 72,000 microliters. A normal platelet count is between 130,000 and 400,000 microliters. Ill, the patient had trapped, killed, and skinned 2 prairie dogs, 4 coyotes, and 1 bobcat. The patient cut his left hand at some point shortly before skinning a prairie dog. This then gave the microbes a portal of entry into the patient's body, infecting him through the cut. PCR and typical biochemical testing of a gram-negative rod isolated from blood cultures helped to identify the organism as Yersinia pestis, which is the organism that causes plague. The patient received an antibiotic cocktail of gentamicin and tetracycline and eventually recovered after 6 weeks of intensive care. With proper timing and care, getting the plague is not a death sentence and can be cured. Systemic infections, more specifically, the plague and the different types of plague. The plague, caused by Yersinia pestis, is more well known as the Black Death. Yersinia pestis is a gram-negative bacteria that can infect both humans and animals, which is a zoonotic disease. The Black Death was a pandemic that occurred in Europe in the mid-13th century that was one of the most fatal pandemics to date. The bite of infected fleas spreads it, and also the animals that are infected spread it. Although the plague isn't a pandemic anymore, it can still be found in rare cases across the rural, western United States and certain regions of Asia and Africa. There are 3 types of plague, named after the parts of your body that get infected. Bubonic plague happens when a pathogen emerges from the site of infection to the lymph nodes, forming buboes, which are enlarged lymph nodes that in some cases turn black. Septicemic plague happens when the pathogen enters the bloodstream and infects the bloodstream. It starts to destroy tissues that can lead to organ failures once the bloodstream is infected. Pneumonic plague is when the pathogen enters through the lungs as after aerosol transmission. This causes shortness of breath and coughing, as well as coughing up blood. Unfortunately, pneumonic plague is the most dangerous type of plague because it's usually fatal. This disease is usually identified post-mortem due to the fact that patients die within 24 to 48 hours of catching it. One upside to bubonic and septicemic plague is that they aren't transmittable and can't be passed from person to person, and they're usually able to be treated if caught with proper timing. Virulence factors like lipoproteins, which have a W and V cell wall surface lipoprotein antigen that inhibit phagocytosis. Another virulence factor of Yersinia pestis is the F1 protein that's a capsule surface antigen, helping to block phagocytosis in mammal hosts. Biofilm formation is also a virulence factor of Yersinia pestis, which helps with attachment and helps with the transmission of fleas by blocking flea digestion in order to make them feel starved, compelling them to find a new host in order to make them feel full again. The next time the flea goes to eat, the blockage will cause the insect to regurgitate the bacteria into the wound, causing infection. Type 3 secretion systems are also another virulence factor of Yersinia pestis because they inject virulence proteins into host cell membranes. The injection of YAP proteins through type 3 secretion systems helps to disrupt the actin in the cytoskeleton and aids in phagocytosis. By evading phagocytosis, the organism begins triggering an inflammatory response and is able to colonize mass amounts of tissue. Here, all the different cycles of the plague, including the sylvatic cycle between fleas and rodents, the urban cycle between fleas and rodents, and also all the different kinds of transmission, how they infect humans, and in which way they affect humans. History of a bullseye rash. Brad, an otherwise healthy 9-year-old from Connecticut, developed a fever and a large 8-centimeter reddish rash with a clear center on his arm. This rash is known to be erythema migrans. He was also exhibiting some left facial nerve palsy. The week prior to symptoms arising, Brad had returned from a Boy Scout camping trip to the local woods where he did lots of hiking. After being asked by his physician, Brad admitted to finding a tick on his stomach during the trip, but thought nothing of it. His physician ordered serological tests for Borrelia burgdorferi, which is the causative agent for Lyme disease, Rickettsia rickettsii, which is the causative agent for Rocky Mountain spotted fever, and Ehrlichia chafensis, which causes ehrlichiosis. The ELISA for Borrelia burgdorferi came back positive, confirming a diagnosis of Lyme disease. The boy was given a 3-week regimen of doxycycline, which is a tetracycline derivative, and this led to the resolution of the rash and palsy. It was first reported in Lyme, Connecticut in the 1970s, but wasn't identified until 1983. Since then, Lyme disease, also called Lyme borreliosis, has become the most common vector-borne illness and is caused by Borrelia burgdorferi. Today, Borrelia burgdorferi is considered an emerging infectious disease, and the
Main endemic areas are the northeast U.S. and the southwest U.S. This disease can also be found in parts of Europe. Borrelia burgdorferi is a spirochete with linear chromosome and is transmitted via deer ticks, also called isodid ticks. Ticks that carry Lyme disease also have a complex life cycle with 3 general stages. The first 2 parts being part of early Lyme disease, and the third part being months to years after contracting the disease. When it comes to treatment of Lyme disease, antibiotics are recommended in all stages, but are most effective during the earlier stages. Doxycycline is the antibiotic prescribed to treat Lyme disease usually. Some patients also benefit from the injection of antibiotics. 3 to 30 days after infection, 75% of patients experience a bullseye rash called erythema migrans and lesions that contain the contaminant. Patients may also experience fever, muscle pain, joint pain, and headache during this time of infection, as well as the bullseye rash. During the second stage of infection, weeks to months after the initial infection, the infection spreads from the blood to other organs, causing the patient to be quite ill. Lyme arthritis and Bell's palsy are also common during this stage, as well as an irregular heart rhythm. The inflammation of joint pain in Lyme arthritis is thought to be an autoimmune reaction which our body is reacting against us. During the third and final stage of Lyme disease, occurring months to years after infection, arthritis becomes more prominent and a higher than normal white blood cell count is also produced. Late neurological involvement of the disease may include peripheral neuropathy, which is numbness caused by nerve damage, as well as the peripheral encephalopathy, which is when your body mimics a stroke. Lyme disease can affect a person's memory, mood, and sleep as well.
21. Systemic bacterial infections by Bella Venezia. Sepsis and septic shock. Sepsis is the infection of the blood. Bacteremia is bacteria in the bloodstream. Septicemia is when a pathogen replicates to high numbers and overcomes the innate immune system. Systemic inflammatory response syndrome, also called SIRS, is a medical emergency characterized by a rapid heart rate, breathing rate, and an abnormal white blood cell count. Septic shock is a catastrophic drop in blood pressure due to severe sepsis, and it's characterized by superantigens or PAMPs, and they play a critical role in septic shock.
symptoms such as organ failure, difficulty breathing, and very low blood pressure can develop. It can be diagnosed with blood cultures and complete blood counts. Elevated white blood cell count may be seen in response to bacteremia. Once blood cultures are obtained, broad-spectrum antibiotics are usually started immediately. After the specific pathogen is identified, the antibiotic regimen may be adjusted to target the causative bacteria more specifically. Common antibiotics used are penicillins and or vancomycin. If bacteremia goes untreated, it can lead to sepsis and even septic shock. It can also infect the heart valves, leading to endocarditis, a potentially life-threatening condition. Septicemia refers to the presence and multiplication of pathogens in the bloodstream, leading to a systemic infection that can spread throughout the body. When an infection causes septicemia, the body's immune response goes into overdrive. This can lead to widespread inflammation in the body, and if not promptly treated, can lead to sepsis or septic shock. The most common cause of septicemia is bacterial infection, but it can also be caused by other pathogens, including fungi, viruses, or parasites. Some of the most common bacteria that cause septicemia include Staphylococcus aureus and Streptococcus pneumoniae. Fungal infections can also cause septicemia, particularly in immunocompromised individuals. Septicemia typically originates from an infection in another part of the body, such as lungs, being pneumonia, urinary tract or UTI, appendicitis in the abdomen, and cellulitis or infected wounds in the skin. When pathogens enter the bloodstream, they can spread throughout the body. This triggers the immune system to release a wide range of chemicals called cytokines and inflammatory mediators, leading to systemic inflammation and possibly coagulation abnormalities. If the infection progresses, it can lead to severe organ dysfunction, including kidney failure, liver dysfunction, respiratory failure, and shock. It has a wide range of symptoms, including fever, chills, tachycardia, tachypnea, hypotension, fatigue, skin changes, decreased urine output, shortness of breath, and nausea. It can also be diagnosed with blood cultures and complete blood counts. These are done to find the specific pathogen. Septicemia requires immediate medical attention, such as antibiotics. Once the pathogen is identified from blood cultures, the antibiotic treatment may be narrowed to target the specific organism. Intravenous fluids are important to increase blood pressure, especially if hypotension is present. Fluid resuscitation is critical to maintain organ perfusion and prevent shock. Source control is important for septicemia if it's caused by an infection in a specific organ or area, such as an abscess or an infected device. Addressing the source is crucial for effective treatment, such as draining abscesses or removing infected catheters.
Guide on sepsis. Sepsis is the body's extreme immune response to an infection. It's a life-threatening medical emergency that happens when an infection you already have triggers a chain response throughout your body. Bacterial infections are the most common cause of sepsis, but fungi, viruses, and parasites can also lead to sepsis. Common sources of infection include the lungs, urinary tract, gastrointestinal tract, the skin, and bloodstream. Signs of sepsis include confusion, clammy or sweaty skin, extreme pain or discomfort, fever and shivering, high heart rate or weak pulse, shortness of breath. Sepsis is usually diagnosed using blood cultures and is usually treated by antibiotics and IV fluids.
Common sources of infection include lungs, urinary tract, GI tract, skin, and the bloodstream. Signs of sepsis include clammy or sweaty skin, confusion, extreme pain or discomfort, fever or shivering, high heart rate or weak pulse, and shortness of breath. Diagnosis of sepsis is primarily clinical, but laboratory tests can help confirm the presence of infection and assess the severity of sepsis. Blood cultures are used to identify the causative microorganism, and CBCs to assess white blood cell count. Lactate levels and liver function tests are performed to assess for organ dysfunction and tissue hypoxia. Treatments of sepsis include antibiotics and IV fluids. Once a pathogen is identified, antibiotics are given immediately. IV fluids are used to combat low blood pressure and dehydration. If the blood pressure remains low despite fluids, vasopressors may be used to help raise blood pressure. In severe cases, oxygen therapy might be used to improve oxygen delivery to tissues and body organs. Sometimes dialysis might need to be used if the body is in kidney failure.
Septic shock include persistent hypotension, which is low blood pressure, organ dysfunction, high lactate levels, and acidosis. Diagnosis of septic shock happens when sepsis is present and the patient remains hypotensive, which means they have low blood pressure. Laboratory tests, imaging, and clinical evaluation are used to confirm the severity of septic shock and the organ systems involved in septic shock. The treatment of septic shock usually includes aggressive fluid resuscitation, vasopressors, antibiotics, oxygenation support, and renal replacement therapy.
Just like for sepsis, treatment includes fluid resuscitation, vasopressors for low blood pressure, antibiotics, oxygenation support if the respiratory system is failing, and renal replacement therapy when kidneys are failing. Normally, when an infection occurs, the body activates the immune system to eliminate the pathogen. In sepsis, this response becomes exaggerated and uncontrolled, leading to widespread inflammation. It can also cause a cytokine storm, which is an overproduction of pro-inflammatory cytokines, and amplifies the inflammatory response and contributes to organ dysfunction. Sepsis can be prevented by good hygiene and infection control, vaccination, and prompt treatment of infections. In summary, sepsis and septic shock are complex, often deadly conditions that require immediate medical intervention. Early recognition and treatment are key to improving survival and minimizing long-term complications.
Next, we will explore systemic infections caused by intracellular pathogens, with a focus on 4 key diseases: thyroid fever, Rocky Mountain spotted fever, tularemia, and cat scratch disease. These are all caused by bacteria that have the unique ability to survive and replicate within the host cell, evading the immune system in the process. Intracellular pathogens are a special class of bacteria that can replicate within the cells of their host, often immune cells like macrophages. This allows them to evade detection and destruction by the host's immune system. These infections can range from mild to severe depending on factors like the pathogen itself and the immune status of the individual. The first systemic infection I will be discussing is thyroid fever. Thyroid fever is caused by Salmonella enterica and is a gram-negative bacterium that is facilitative intracellular. This means it can live both inside and outside of host cells. The primary transition route is fecal-oral, often through contaminated food or water. After ingestion, the bacteria invade the intestinal mucosa and spread to the lymphoid tissue and the bloodstream. This leads to systemic inflammation, which can result in symptoms like fever, abdominal pain, headache, diarrhea, or constipation. Diagnosis is often made through blood cultures, and if it is left untreated, complications can be severe, including septic shock or even meningitis. The most common treatment is antibiotics. I'm now going to talk about the second systemic infection caused by intracellular pathogens, which is Rocky Mountain Spotted Fever, also known as RMSF. RMSF is caused by Rickettsia rickettsii. This pathogen is transmitted through the bite of an infected tick. Once inside the host cell, it targets endothelial cells lining blood vessels. Symptoms of RMSF include sudden onset fever, headache, muscle aches, nausea and vomiting, and a rash that begins on the wrists and ankles and spreads to the entire body. Diagnosis is typically made through a skin biopsy, and early treatment with doxycycline is essential, as delayed treatment can lead to severe complications. I'm now going to move into the third systemic infection caused by intracellular pathogens, which is tularemia, caused by Francisella tularensis. This is a zoonotic disease transmitted through tick bites. It can also be caused by handling infected animals. Once inside the body, it infects macrophages and spreads to various organs, including lymph nodes, lungs, liver, and spleen. Symptoms include sudden fever, chills, and headache. Diagnosis is often made through PCR or serology, and the first-line treatment is streptomycin, although doxycycline can also be effective. Finally, I will talk about cat scratch disease, which is caused by Bartonella hensleyi. This disease is typically transmitted through the scratch or bite from an infected cat with fleas, believed to be the vector. Bartonella primarily affects endothelial cells and red blood cells, triggering an inflammatory response. Symptoms include a small palpable at the site of the scratch or bite, fever, and fatigue. Diagnosis is based on clinical history and confirmed through PCR or serology. Treatment for more severe cases can include doxycycline.
Hi, I'm Madison Hauk, and today we'll explore several critical cardiovascular conditions that affect the heart and blood vessels, including pericarditis, myocarditis, endocarditis, subacute bacterial endocarditis, acute bacterial endocarditis, prosthetic valve endocarditis, and atherosclerosis. Each of these conditions has its unique features, but they all share the potential to significantly impact health, if not addressed promptly. Now let us look at a case history. Elizabeth was a 58-year-old woman who had a history of mitral valve prolapse, a common congenital condition in which a heart valve does not close properly. She was on immunosuppression therapy because she had a kidney transplant, and she had just recently been admitted to the hospital for fatigue, intermittent fevers for 5 weeks, and a headache for 3 weeks. The symptoms had rang a bell in the physician's head for possible indications of endocarditis. When asked, Elizabeth had reported that she had a dental procedure about 3 weeks prior, or a few weeks prior, to the onset symptoms, but she had forgotten to take her prophylactic antibiotics beforehand. Then there was taken a sample of her blood and it was placed on
a liquid bacteriological medium and grew gram-positive cocci, which had turned out to be Streptococcus mutans, a bacterial species associated with dental caries, which aka are cavities. With the findings of this bacteria in the bloodstream, the diagnosis of bacterial endocarditis was confirmed. Elizabeth had began a 1-month course of intravenous penicillin G and gentamicin therapy and eventually recovered to normal health. Yay. Heart infections are not systemic. Heart infections are microbes that enter from a certain part of the body and they spread through the bloodstream. This allows it to get into the circulatory system, which carries the infection throughout your body, which can infect other organs and tissue. Pericarditis is the inflammation of the pericardium, the protective sac surrounding the heart. It can occur due to infections, autoimmune diseases, or after a heart attack. Symptoms may include sharp chest pain, which often worsen with deep breaths or coughing, fever, fatigue, and a pericardial friction rub, a distinctive sound heard with a stethoscope. Causes may include bacterial infections such as Streptococcus pneumoniae, autoimmune disorders like lupus, or even following a heart attack or surgery. Treatments are anti-inflammatory drugs and antibiotics, and in severe cases, drainage of the pericardial fluid may be required. With appropriate treatment, most cases resolve, but the reoccurrence can occur. Myocarditis is the inflammation of the heart muscle itself, often due to sepsis. It can also be caused by autoimmune diseases, bacterial infections, viral infections, or even certain medications. Symptoms include fatigue, shortness of breath, chest pain, palpitations, and in severe cases, heart failure or arrhythmias. Common causes are viral infections like influenza, autoimmune diseases like rheumatoid arthritis, adverse reactions to drugs, or bacterial infections like Streptococcus pyogenes. Treatments: there's no specific antiviral treatment for most cases. Management is supportive, often with anti-inflammatory medication and antibiotics, and sometimes heart failure treatments if complications arise. The outcome varies. Mild cases may recover completely, while severe cases can lead to chronic heart failure or even sudden cardiac death. Both of these are rare due to all the antibiotic therapy, but myocarditis is more severe. Endocarditis is an infection of the inner lining of the heart chambers and valves, usually caused by bacteria. It can occur in healthy hearts, but more commonly affects those with pre-existing heart conditions or prosthetic heart valves. It is commonly caused by bacterial infections that most commonly cause this disease, including many streptococcal and staphylococcal bacteria. Viral and fungal forms of this disease stem typically from patients who have had transplanted heart valves. Symptoms may include fever, chills, fatigue, heart murmurs, signs of organ damage due to strokes or kidney damage. Risk factors may include poor dental hygiene, intravenous drug use, heart valve abnormalities, or recent surgeries. Treatment includes prolonged intravenous antibiotics and, in some cases, surgery to repair or replace damaged heart valves. Prognosis includes, if treated promptly with antibiotics, the prognosis is good, but delays can lead to severe complications like heart failure or embolic events. Endocarditis is hard to treat because sometimes it creates a biofilm. These are some of the bacteria that causes pericarditis, myocarditis, or endocarditis. Although I'm not going to go through these, you can take a picture if you'd like to. Subacute bacterial endocarditis. SBE is a slowly progressing infection of the heart valves, typically caused by less virulent bacteria like Streptococcus viridans. It often affects the individual with pre-existing heart conditions. Symptoms include fatigue, low-grade fever, weight loss, night sweats, cough, joint pain, diarrhea, shortness of breath, and pain in the abdomen. Symptoms may develop over weeks to months, making early diagnosis difficult. Risk factors include previous heart valve damage, congenital heart disease, and dental procedures without prophylactic antibiotics. To treat this disease, prolonged antibiotics prescribed often for 4 to 6 weeks. In severe cases, valve surgery may be necessary. With appropriate treatment, SBE can be controlled, but the condition may require ongoing monitoring. Contaminating needles can introduce this bacteria, so intravenous drug users need to be checked for SBE when in the hospital. Acute bacterial endocarditis. In contrast to SBE, ABE is a rapid and severe infection, often caused by highly virulent organisms like Staphylococcus aureus. It can affect even previously healthy heart valves. Symptoms include sudden onset of high fever, chills, severe fatigue, rapid heart failure, abscess formation, and valve regurgitation. Complications include clots or infections traveling to other organisms. These can cause strokes, kidney damage, or pulmonary embolisms. Treatments are immediate hospitalization, high dose of intravenous antibiotics, and potentially an emergency surgery to repair or replace damaged valves. Prognosis is, if untreated, ABE can be fatal within weeks, but early intervention with aggressive treatment can save lives. Prosthetic valve endocarditis, PVE, occurs in individuals who have received artificial heart valves. It can be classified as early or late onset, with symptoms similar to those to SBE or ABE. PVE is commonly caused by Staphylococcus epidermis and Staphylococcus aureus. Symptoms include fever, fatigue, heart murmurs, and signs of embolic events. It's often harder to treat due to the formation of biofilms on the prosthetic valve. Risk factors include recent valve replacement surgeries, immunosuppression, and hospital-acquired infections. To treat this infection, long-term antibiotics, often tailored to the specific pathogen, and possibly valve replacement surgery if the infection is severe. To prevent this disease, strict antiseptic techniques during surgery and close follow-up after valve replacement are critical to reducing the risk of PVE. Atherosclerosis is the buildup of plaque in the arteries, consisting of fat, cholesterol, and other substances. Over time, it can narrow arteries and restrict blood flow. It can also harden the arteries, this leading to heart attacks and strokes. Symptoms often are asymptomatic in the early stages. As it progresses, symptoms depend on which arteries are affected. Coronary artery disease can cause chest pains or heart attacks. Carotid artery disease can lead to strokes. Risk factors are high cholesterol, hypertension, smoking, diabetes, obesity, and sedentary lifestyle are major contributors. Complications can arise like heart attacks, strokes, aneurysms, and peripheral artery disease. In order to prevent this, a healthy heart lifestyle is crucial. This includes a balanced diet, regular exercise, quitting smoking, and managing blood pressure, cholesterol, and high blood sugar levels. Medications may also be prescribed to manage this condition.
My name is Ava Tatuli, and I will be covering the systemic parasitic infections. The main objectives of this section are to construct a list of systemic parasitic infections according to the type and mode of transmission of each parasite, relate the different stages of systemic parasitic diseases to the growth cycle of the infecting agent, list the organ systems affected by each systemic parasitic infection discussed, and devise a plan for preventing infection by each systemic parasite discussed. The first infection to go over is malaria. Malaria is the most devastating infectious disease that is known due to the fact that in 2017, 219 million people were diagnosed with this disease, and 435,000 people succumbed to it. Although this disease is rare in the United States, it could still be obtained as a result of international travel to areas where malaria is prominently known. Malaria is transmitted by 4 different species of Plasmodium: Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale, and Plasmodium malariae. Plasmodium involves 2 different life cycles. In humans, it goes through an asexual erythrocytic cycle, while in mosquitoes it is a sexual cycle. The treatment for malaria includes chloroquine. The picture on the right indicates the parts of the world in dark pink where malaria is very common, the lighter pink shows where it occurs but less likely, and the green shows where transmission is not known to occur. Throughout the erythrocytic cycle of Plasmodium, the organisms are transmitted into the blood through a female mosquito's bite. After the sporozoites travel into the liver and go through asexual fission, merozoites are released and their job is to attach and infiltrate red blood cells. Plasmodium then consumes the hemoglobin and becomes a trophozoite, which is a form of parasite shown as the dark ring-like structures in red blood cells in the picture on the slide. The cell nucleus divides and becomes a schizont. The cell lyses and releases merozoites, which causes the symptoms of malaria. The main symptoms are fever, sweating, and intense chills, and these symptoms and the erythrocytic cycle repeat every 2 to 3 days. After multiple cycles, the patient goes into remission and after several weeks or months eventually relapses. This occurs due to the Plasmodium sticky PFEMP1 protein that adheres blood cells to blood vessels. This protein cannot protect the parasite from the host's immune system, so macrophages detect this parasite and cause other immune cells to fight it off as well. Now the parasite invades more erythrocytes and repeats the cycle of symptoms. The first photo shown is the detailed life cycle of malaria, very similar to what was explained in the previous slides. The smaller photos show a great clarification of how the parasites affect the red blood cells and cause them to eventually lyse and release the merozoites. The second picture shows the Plasmodium falciparum inside the red blood cell. The cell has already lysed, and this is depicting a ghost cell. Merozoites are shown outside of the membrane. Diagnosis for malaria includes seeing the protist inside of the erythrocytes or using serology to see the anti-malarial antibodies. As far as treatment goes, chloroquine or mefloquine can both kill Plasmodium in erythrocytic asexual stages, while primaquine can kill it in exoerythrocytic phases. Throughout time, Plasmodium has developed resistance to these drugs, and a new form called artemisinin has been created. This works by generating free radicals in the parasite in order to damage proteins. Since malaria has antigenic shape-shifting abilities, it has prevented the route of developing a vaccine. Since this is not an option, prevention methods include avoiding the vector and their bites and screening the blood supply. The next parasitic disease is a protozoan called babesiosis, which is caused by Babesia microti. This has similarities to malaria, but it is transmitted from ticks to humans instead of mosquitoes. The ticks that carry this disease have fed on mice and other mammals. Some patients who have babesiosis are also infected with Borrelia burgdorferi. This organism has a characteristic cell arrangement when it grows inside of red blood cells. This formation is also called the Maltese cross formation. Babesiosis has a range of symptoms depending on the patient. Immunocompetent patients may not even have any symptoms, and if they do, it most likely presents as a mild flu-like illness with fatigue, fever, and feeling weak. In other patients who have compromised immune systems, it can be a prolonged illness and can even be fatal for those who are severely immunosuppressed or have had an organ transplant. As far as diagnosing babesiosis, microscopy with thick and thin blood smears can be used, as well as other molecular methods and serology. In the picture on the right, the organism is shown within the red blood cell. In the first photo, you could see the ring-shaped trophozoite. In the second picture, you can see two merozoites, and in the third picture, you could see a tetrad forming in the Maltese cross formation. There is no vaccine for this infection, but the treatment can vary depending on the severity of the disease and the age of the patient. The main treatments include atovaquone, azithromycin, clindamycin, and quinine. Chagas disease is a disease caused by a protozoan, Trypanosoma cruzi. This is common as about 10,000 people die from this disease each year. This protozoan is found in the domestic and wild animals that reside in South America and the southern United States as well. The organism grows in the gut of the reduviid bug, which is a blood-sucking creature that lives in mud or stone huts to find the source of blood to consume. The insect defecates while consuming blood, meaning that it leaves droppings at the site of the bite. The irritation from these droppings causes the human or the animal to rub the feces into the broken skin. A lot of the time, the bites are around the mouth, which has caused the kissing bug nickname to form. And another common entry is through the sclera, when people rub their eye with an infection on their finger, causing an edema around the eye and on the face. Diagnosis comes from the serology or PCR for the acute phase. It can also be from the observation of clinical presentation if patients come in with facial edemas. Within a week of having this disease, the mild symptoms start with a fever and swollen lymph nodes. A small portion of people infected will have more aggressive symptoms where the liver and spleen become enlarged, neurological problems develop, and myocarditis. These symptoms will resolve while the parasite remains in the system of the victim. Treatment methods include nifurtimox and benznidazole. After about 4 to 6 weeks, if it is not cured, patients develop a chronic form. This happens in about 20 to 30% of patients. The chronic form attacks many organs such as the heart, gastrointestinal tract, and the nervous system. Most of that time that death occurs from Chagas, it is due to heart failure when myocarditis destroys the muscle layer of the heart. This disease can be transmitted vertically to offspring, but not person to person horizontally. Transmission can also occur from contaminated blood transfusions, contaminated organ transplants, contaminated uncooked food, and less commonly from lab exposures. There is no vaccine available for this disease. The photo on the left shows the reduviid bug, which is where the Trypanosoma cruzi grows. The right picture shows an edema that is formed on a patient's face due to the spread of the bug's feces from touching her face. Toxoplasmosis is also caused by a protozoan called Toxoplasma gondii. This organism has a very complex life cycle because it starts its life in a cat and ends its life in a different intermediate host such as a bird or a mammal. When a cat ingests this organism, it does not become sick, but its body becomes the breeding ground. Zygotes are formed within a cat's intestinal tract, and these zygotes form a wall around themselves and are able to be released. The cats release these gametes through defecating, and after being exposed to the air, spores form and mature. These spores are eventually ingested by other mammals and birds, and after the stomach acid of these victims dissolves the cyst wall, spores are released into their small intestine and divide rapidly and grow into cells called tachyzoites. They spread extremely quickly through the blood and organs, and then change into a slower dividing version called bradyzoites, which become encapsulated in a cyst while the immune system starts defending against tachyzoites. Cyst formation occurs mainly in the muscles and central nervous system, and immunocompetent patients will have little to no symptoms at all, while the immunosuppressed patients may have a release of parasites spontaneously. Much more serious symptoms can arise, such as brain infection, and congenital disease is another serious problem with toxoplasmosis. This disease can cross the placenta to a developing fetus and cause many severe issues, but this can be prevented with screenings for antibodies and treated if the test comes back positive. Diagnosis mainly comes from serology and the observation or isolation of the parasite in bodily fluids. The main effective treatment is the administration of pyrimethamine. There is no vaccine available to prevent this disease. The top picture on the right shows the microscopic cysts that contain the protozoan that develop within tissues of patients, and the bottom picture shows a tissue cyst containing many bradyzoites. This next slide shows a detailed life cycle of Toxoplasma gondii, and it shows many different transmission methods and how they occur between the main host of cats and their intermediate hosts of birds and other mammals. It also shows how the organism moves through the body and how the parasite affects the blood and the organs.
I'm Caitlin, and the systemic infection I will be introducing is Leishmaniasis. Leishmaniasis is a disease caused by a protozoan of the Leishmania species. This comes from two forms, a cutaneous form and a visceral form. The cutaneous form is produced from Leishmania tropica and Leishmania brasiliensis. Cutaneous requires a cooler temperature of 91 degrees Fahrenheit of the skin to be able to grow. Leishmania donovani produces the visceral form. This form can grow at core body temperature, which is 98.6 degrees Fahrenheit. The protozoa that causes this is transmitted by the female sandfly. They are usually smaller than a mosquito and found in tropical areas in the Middle East and around the Mediterranean. The visceral form of leishmaniasis is a more severe form of the disease. Symptoms include fever, hepatosplenomegaly, which is an enlarged spleen and liver caused by accelerated production of phagocytic blood cells, wasting and weakness, lymphadenopathy, the swelling or enlargement of the lymph nodes, and darkening of the skin. Patients may die within months of contracting the disease due to hemorrhage, anemia, pneumonia, tuberculosis, or the measles. The treatment for the disease is an antiparasitic drug. This contains a chemical element called antimony that is most commonly used for treatment. Miltefosine, an oral drug, is also used in some countries. The drug triggers cell death to help kill it off. Systemic infection is lymphatic filariasis. Filariasis is a group of diseases caused by nematodes, also known as roundworms, in the family Filariidae. Around 120 million people worldwide get infected by filarial worms. This is primarily present in Africa, Asia, the Eastern Pacific, and Indonesia. Filariasis has three different groups: a cutaneous group, lymphatic group, and a body cavity group. We will mostly focus on lymphatic filariasis because of its systemic nature. Starts when larvae are transmitted to humans, which is known as the host, by an insect bite, which is usually a fly or mosquito. From there, the adult worms develop and multiply in the human lymphatic system. Here, the adult worms mate and produce millions of microfilariae that then go and enter the blood. These adult worms can live and produce microfilariae for at least 5 years. Lymphatic blockage resulting from the presence of adult worms and inflammation causes accumulation of lymph and enormous swelling of the affected areas. These examples are mild cases. If caught in the early stage, it is very treatable. Microfilariae are ingested by a second insect, which would be known as the intermediate host, taking a blood meal. This means that after you are infected, another insect comes and bites you. This passes the infection to that insect and it then spreads it to another host. The last stage is that the larvae progressively develop from the L1 to L3 stage in the mosquito. The larvae can get up to about 1.5 millimeters long. The process then starts over with the larvae infecting another host. I'm going to be giving a summary of Chapter 21, the systemic infections, and explain the portals of entry and exit. The virus in Chapter 21 is the Epstein-Barr virus. This is also commonly known as mono or the kissing disease. The Epstein-Barr virus enters the body through mucosal surfaces. This is most commonly through saliva by either kissing or sharing silverware.
It could also be spread by respiratory droplets, such as when someone coughs and you then breathe that virus in. The portal of exit is the same through mucosal surfaces by saliva or respiratory droplets. Is cytomegalovirus, also commonly known as human herpes virus 5. CMV enters the body through mucosal surfaces, for example, saliva, sexual contact, and blood. The virus then exits the body by shedding the virus through urine, saliva, or blood. Another disease is the dengue hemorrhagic fever. The portal of entry is by the bite of an infected mosquito. The portal of exit is the same. After the mosquito bites you, you are then infected by the disease they are carrying. Then another mosquito comes along and bites you and transfers it to another host, infecting someone else. Ebola virus is primarily spread by broken skin or mucous membranes, such as eyes, nose, mouth, or when you come in contact with infected body fluids, such as blood, saliva, sweat, or urine from an infected person. The portal of exit is also through those same bodily fluids. Chikungunya virus. The portal of entry and exit are from the bite of an infected mosquito. Entry for the plague is by either broken skin or a bite. The portal of exit is different for each type of the plague. The bubonic plague's portal of exit is by either buboes, which are swollen lymph nodes, or from respiratory droplets from an infected person. The septicemic plague exists through the blood or bodily fluids from an infected person. The portal of entry and exit for the pneumonic plague is by respiratory droplets from when an infected person either coughs or sneezes. The disease mentioned in chapter 21 is Lyme disease. The portal of entry for this disease is from a bite of an infected tick. The portal of exit is also from the bite of a tick. It has the entry portal through the ingestion of contaminated food or water that contains the bacteria. It then exits through feces or through your urine. Rocky Mountain spotted fever is caused by Rickettsia rickettsii. Has the portal of entry from the bite of a tick. While the tick bites the host, they defecate at the bite site. The portal of exit for the bacteria is through the tick's saliva when the tick feeds on the infected host. The bacteria is transmitted to other hosts when the tick bites and feeds. Rocky Mountain fever is not transmitted directly from person to person, but spreads through tick bites. The portal of entry for subacute bacterial endocarditis is usually through the oral cavity or skin, with the portal of exit through the bloodstream. Acute bacterial endocarditis also enters through the skin or oral cavity and exits through the bloodstream. Next infectious disease is malaria. Malaria enters the body when an infected mosquito bites someone. The exit is the bloodstream when another mosquito bites them, taking a little of the blood with them. Is transmitted to humans when a tick that has fed on infected white-footed mice bites them. The primary portal of exit is through the bloodstream, as the parasites are released from red blood cells during their replication. Additionally, ticks serve as a secondary exit by acquiring the Babesia from infected hosts and transmitting it to a new host. Chagas disease enters the body through an infected bug bite or mucosal membranes. It is transmitted through rubbing feces into the bite site or mucous membranes. The parasite exits the body primarily through the feces of the bug. Infected individuals may also release parasites into their bloodstream. Toxoplasmosis is transmitted through the ingestion of contaminated food, contaminated water, or contaminated cat feces. The portal of exit is through the bloodstream. Filariasis enters the body when an infected female sandfly bites a host. The primary portal of exit is through the blood or skin lesions in infected humans. The sandfly bites and feeds on the host's blood, ingesting the parasites along with it. The parasites are then transmitted to a new host when the sandfly bites again. The last infection is filariasis. The primary portal of entry for the filarial worms is through the bite of an infected mosquito. When an infected mosquito bites a human, it injects infective larvae into the bloodstream. These larvae then travel to the lymphatic system where they mature into adult worms. The adult worms can cause obstruction and inflammation in the lymphatic vessels, leading to the characteristic swelling seen in lymphatic filariasis. The main portal of exit for the filarial worms is through mosquitoes. When an infected mosquito bites a human, it ingests the microfilariae from the bloodstream. These microfilariae mature inside the mosquito and are transmitted to the next human host when the mosquito feeds again.